Hi everybody, my name is Logan Martin, and today I'll be showing you my presentation on common ocular conditions. But most of you have probably heard of and probably know something about the big three ocular conditions such as cataracts, macular degeneration, and glaucoma. You probably know a lot less about much more common conditions. I will be discussing those common conditions today so you can learn more about them. Let's start off with the first condition I'll be talking about. Myopia is a relatively common condition. In fact, it is common within about 41% of the U.S. population, according to the National Eye Institute, wherein lengthening of the eye changes the position of the retina versus the lens, leading to incorrect refraction of light and blurriness. Myopia is corrected traditionally via either glasses or contact lenses, but can also be treated via various forms of myopia management, such as atropine, orthokeratology, or peripheral defocus contact lenses. Let's talk about our next condition, which in this case is hyperopia. Hyperopia is in many ways the opposite of myopia, wherein changes in the length of the eye cause the retina and the lens to get closer instead of farther, meaning reflected light is aimed behind instead of onto your lens. Hyperopia isn't necessarily treatable, but can be corrected for via the aforementioned contacts and glasses, as can most of these conditions I'll be talking about. Presbyopia is a condition seen in older patients, or at least traditionally seen in older patients, wherein the patient's ocular lens becomes rigid with age, meaning its ability to change focus rapidly is decreased. Like most of the previously mentioned conditions, presbyopia can be corrected via contacts and glasses, but it can also be treated with or corrected for via refractive surgery or even eye drops. Astigmatism is a very common form of refractive error. In fact, I would hazard to guess that a decent percentage of you have an astigmatism and have been dealing with it your entire life. Astigmatism is mainly related to the curvature of the cornea. This can cause blurry vision, the need to squint, eye strain, poor night vision, and even headaches, among other possibilities. Astigmatism is corrected via the usual methods, but specialty contact lenses, glasses, refractive surgery, and even some forms of orthokeratology can also assist in correcting astigmatism during your daily life. Amblyopia is a condition wherein during childhood one eye does not develop properly. Commonly referred to as having a lazy eye, amblyopia can be caused by a variety of conditions from refractive error to strabismus, where your eye is pointed in two different directions. The best way to correct amblyopia is by having the child make use of their underdeveloped eye. This can be achieved in various ways, but is most commonly done by having the child wear an eye patch as to where they are forced to use the eye that is weaker than the other one. While not as common as some of the other conditions discussed here, macular pucker is an interesting condition wherein, as you get older, the vitreous shrinks, pulling away from your retina and leading to a vitreous detachment. This can lead to a membrane forming over the macula, which in turn leads to distortions in your vision known as puckers. As you can see here by this chart here, here's an example of what this grid might look like if you had macular pucker. You can see all the curves and everything in it. While macular pucker is a very mild condition that would not normally require treatment, if need be, it can be treated via surgery such as membranectomy. The final condition I'll be discussing today is blepharitis. Blepharitis is a condition caused by bacterial buildup on the eyelid, which leads to a variety of issues such as irritation, watering, burning, swollen eyelids, and even light sensitivity, among other things. Blepharitis is treated in a similar way to any other bacterial-caused condition, with the possibility of antibiotic eye drops, steroids, a simple warm compress, or lid hygiene products. Here's a little interesting chart I thought of what blepharitis might look like. You can notice how red his eye is. All these white dots are representing what some of the bacterial infection may look like externally. That should be that. I hope you enjoyed my presentation on common ocular conditions, and I hope you learned something today.